Hi, my name is Dr. Salil Khandwala, and I'm the Director of Urogynecology at Advanced Urogynecology of Michigan. Today I'm going to discuss about whether a woman should ever wear pads for urinary leakage. So I saw this ad in the paper and it talks about different types of pads. And then I recently went to Costco, the wholesale club, and this is what I found an entire aisle filled with women's, not just men's, but women's incontinence pads only. Can you imagine an entire aisle? So now that I thought, okay, well, this is it. This is it. It was the last hair on the camel's back. I need to talk to my patients and women about should ever pads be worn for urinary leakage. So let's start from the basics. The normal anatomy. This is the head end, the foot end, front, and the back. You're looking at the bladder here. The urethra is the tube that brings the urine outside, the vagina at the back, the uterus on the top, and the rectum behind it. So this is how the typical female pelvic organs are deployed. The kidneys, which are located in the upper back, filter the blood and produce urine, which is then transported by these two tubes called the ureters into the bladder. And the bladder then stores the urine and opens up just like this when it's time to urinate. And all this is controlled by the nervous system. So what is urinary incontinence? Essentially, it is leakage of urine that happens beyond one's control. That's why it's called involuntary. Nobody wants it to happen, it just happens. And there are different types: stress, urge, and mixed. So let's talk about stress incontinence. This is what happens with any effort: coughing, laughing, sneezing, lifting. Urge incontinence is that gotta go sensation that before you can actually make it to the bathroom, urine is just running down your legs and there's nothing you can do about it. Then there is this last minute urge incontinence that you're almost there, about to sit on the toilet seat, and it starts coming out. That's the urgency incontinence problem, and the combination is called mixed incontinence. So this gotta go problem happens because there is in a child this classic reflex. As the bladder fills up, it says, hey, I've gotta go. And then the spinal cord reflex sends back and says, all right, go. And the bladder empties. However, as the child becomes more mature and sees what's happening around him or her, the brain starts taking control. And the brain realizes that, no, I need to go to this place called the bathroom. I just cannot pee in my diaper. And this part of the brain, called the frontal or the intelligent lobe of the brain, takes control, and it blocks the pontine center, which stimulates the bladder, and also it blocks this reflex. So right now, as I'm talking to you, my reflex is going on. It's the afferent is saying, hey, I've got to go. And it possibly, if my brain was not controlling it, would say go. But my brain says, nope, I'm giving a talk, so you cannot go. And that's how the bladder gets controlled. But unfortunately, for some reason, this control becomes a little bit sluggish, or the reflex arc becomes very potent, and there is this gotta go or overactive bladder, or the bladder just contracts and urine comes out. So if you look at the pelvic anatomy, this is how the pelvis is. This is the muscles in the pelvis, and there are three openings in the muscles. Here you're looking from the top down. This is the pubic bone at the front, this is the tailbone at the back, and these are the two wing bones on each side. So you have the urethra here, the vagina, and the rectum. Let me show you a little bit of a video as to how this anatomy looks. So now let us review the female bony pelvis. So this is the bony pelvis, this is the back, this is the front, and these are the two side bones on each side. So as you can see, the tailbone is here, the pubic bone is in the front. On the inside, you can actually see the different muscles, and this is the main pelvic floor muscle, and you can see that it is giving support to the three different organs. You have the rectum at the back, the vagina in the middle, and the urethra in the front. That's where the bladder would be. So the three pelvic organs are supported by these pelvic muscles. So therefore, on top of those muscles are these ligaments, and these ligaments support the urethra and the bladder, the vagina and the uterus and the rectum at the back. And this again is how the normal organs are held because of the proper muscles and the ligaments. However, if the ligaments and the muscles do not do their job, then we have a problem. So let me show you a simple analogy of a boat and its anchors or the moorings and what happens. The pelvic floor muscle is always tightly contracted. It is like the water that's keeping the boat afloat. Very important to have. The moorings and more like the ligaments which are holding the boat in place and preventing it from going adrift. So it's very much like holding the uterus and the vagina in place with the ligaments and preventing from moving forward and backwards. However, if the water starts drying up and the muscles start weakening, the uterus will try to come down, then the ligaments come into play and they get try to hold it and hold it. Then as it gets even weaker, the ligaments start putting tremendous strain on them, and ultimately the ligaments will snap and there is prolapse. So therefore, it is important to understand that prolapse or urinary incontinence is an interplay of the muscles and these ligaments. So the muscle weakens, like in this case, and the ligaments tear, then you get incontinence or prolapse. So in this case, as you can see, stress incontinence, the bladder is here, the urethra is here. When she coughs, it should remain there. It should really not fall down. But if the ligaments and the muscles have weakened, from here it'll drop down to here, the urethra funnels open, and there is leakage. It's a big problem. Urinary incontinence is a huge problem. It affects at least 1 in 3 women. And it has got nothing to do with age. It's an absolute misperception that it is a problem only of the elderly. There are so many young women who have incontinence, as many as the elderly. There is ultimately nothing to get embarrassed about because it is a medical condition like any other, like high blood pressure or diabetes. This too is a medical condition. It's not something that you should be embarrassed that you did something wrong and that is why you had incontinence. So, should any woman have to do this? And so many of my patients tell me that when they run into the bathroom, they have to press in the perineum or they have to do what they, jokingly call the pee dance. But of course, there is no humor in that. It is clearly a medical condition that should be addressed and looked into. Every woman wants to do this. They want to run, they want to do jumping jacks, jump on the trampoline. Nobody really wants to be thinking about the bathroom all the time. Now there are bathroom apps that come and tell you which is the bathroom close by and call a toilet finder or know whether it's clean. So even the apps have taken on to this about how to help with urinary issues. And of course, the topic of contention today, diapers and pads. Now there are multiple companies making pads and making a phenomenal revenue on these pads. No doubt that whole aisle at Costco was filled with these pads. There is even something that you can insert into the vagina that potentially blocks the urethra, like a tampon, and it's called, in this case, Poise Impressa. So we put the Impressa tampon inside the vagina. Patient was leaking when she was lying down. Here we have the same bladder volume of about 20 ml. And go ahead and give me a cough here. And cough again. And you can see the incontinence is still there. So question then becomes the topic for today. Should you ever wear an incontinence pad? Well, I would say absolutely not. You should not be wearing pads, and I'll explain to you why. There are just a few reasons why one may want to or have to wear incontinence pads, and these are a few. Short term, prior to getting the incontinence treated, so before you come in or while we are working this up, you may have to wear a pad. Long journeys with limited access to bathrooms, which again are few and far between because especially in United States, there are bathrooms everywhere. Treatment tried, but no improvement in symptoms, and now you're awaiting a change of the treatment plan and working on it. So you may have to, at that moment, for a short term, wear a pad. Long term, essentially, it's very simple. If a woman cannot help herself, so she doesn't know where she is or what she is doing, then there is little that we can do. And that's usually in patients with dementia and Alzheimer's. Some patients who have extremely limited mobility, that they are wheelchair bound and they take a long time to make it to the bathroom, where you and I may take a few seconds and they take several minutes, then yes, they may have to wear pads. And in patients who have significant medical comorbidities, such as morbid obesity, uncontrolled, very bad diabetes, significant heart failures where they're on tremendous number of diuretic medications, and here incontinence becomes difficult to control. So just a few, I would say less than 5% of women who today are wearing pads should actually be wearing pads. Less than 5%. So, why should you not wear incontinence pads? Well, psychologically, it is depressing to wear pads. It makes a young woman feel old. And she says, I just got off wearing pads with my menses, and now I have to wear pads again. And a postmenopausal lady say, oh my God, thank God I don't have to wear pads ever for menses and my menstrual bleeding. But now, unfortunately, I have to wear a different type of pad because I have urinary leakage. So essentially, these pads make you dependent, and then you keep wearing them. And it is difficult to engage in spontaneous intercourse and makes a woman feel unhygienic, as though she smells of urine, even though she has a pad on. She feels that she smells of urine and she doesn't want to socialize, whether it's sexually or otherwise. Physically, also, it has a problem. Because the pad is there, now you really don't feel the need to focus on your muscles because now you're counting or depending upon the pad. That's why the word depends, depending upon the pad to do the job. So your muscles are saying, hey, why should I bother, contract, or be tight and hold it in place if the pad is there to take care of it? So the muscles become weaker. Pads cause irritation. Constantly, it is covering the vagina all the time. Then there is discomfort. Vaginal health may get compromised, and it may act as a conduit for colonic bacteria to move forward, especially if there is some bowel seepage happening also, then the stools can spread up towards the urethra. If something is put as a tampon inside the vagina, of course, there's a risk of toxic shock syndrome or a urinary tract infection. Socially, you cannot wear tight pants, always have to wear dark pants, cannot go out for workout classes with friends, cannot wear tight yoga outfit. It's embarrassing to go and buy pads at a store. I mean, who wants to do that? Wear incontinence and buy incontinence pads. And it takes away even the desire to have intercourse because you have a pad on, you got to change the pad, and as I mentioned earlier, the spontaneity is gone. Bottom line, you become dependent on the pads, and this becomes a lifelong crutch. Pads provide a false sense of security and prevent you from seeking true help that can fix this problem once and for all. So then, why do women wear pads? Well, they feel that urine leakage is a normal part of aging. You've seen your mother probably buy some pads, your grandma used to wear pads. So, you think, well, you know what? It's just happening to me and it's my turn now. You don't know who to turn to, and that's a big problem. You turn to the doctors, and we tell you just do Kegel exercises, and you think, okay, well, that's all there is, because that's all this doctor told me. Or if you turn to the internet, then this is what you see: mesh complications and scary information that you may see on the web, or a friend or family had a bad experience, and then you say, forget it, I don't want to deal with this thing, it's too much of complications and scary news, I might as well wear a pad. More importantly, most women don't even know. I mean, so many doctors don't know what we can today offer our patients who have urinary leakage. So, how can I expect women to know if doctors don't know? They don't know what it involves. They don't know what is the success, the recovery, and potential complications. How much time do they have to take off from work? Is it done in an office? Is it done in a hospital? Where is the procedure or treatment done? That's one aspect. The second is the treatment non-compliance or failed. So they may have tried a treatment and it didn't work, or it was too costly, or had significant side effects, and they say, forget it, I might as well just deal with it and keep wearing pads. Look at this. Now, this is such an important sentence. Just watch what I'm reading. Do you know that 65 to 75% of patients with bothersome urine leakage do not return back to their specialist after one office visit? Keywords: 60 to 75% of women with bothersome urine leakage. It's not it's gone. They do not go to their specialist doctor, someone like me, not just your primary care doctor. After one office visit, they're done. They say, forget it. I'm going to deal with this and wear a pad. And there are many, many, many reasons for this, and that's a discussion for next time. So it's easy to put it off and wear a pad, Hey, did that for menses. People are doing it for incontinence. That's all I see in my, in the aisles: pads, pads, pads. Easy access right in the female hygiene aisle. They're glorified by ads on TV like the one I just showed you, and women are used to wearing pads for menses. So they say, well, you know what? I wore it for menses. Now it is my turn, like my mother and my grandma, and it is my turn for urinary leakage. But please remember, pads are not a solution to the problem. They do not fix the problem. They just hide the problem. They give the woman a false sense of dryness and encourage procrastination. That is why, sadly but truthfully, most women wait at least 3 to 5 years before they come seeking help. Even before they come seeking help for the first time, they wait this long. Pads encourage procrastination. That is why they wait long, as I mentioned here. So then question is, then you'll ask me, all right, doc, you're talking all these things about why I should not wear pads. Well, then can urine leakage be corrected? Absolutely, it can be corrected with almost complete success in most cases. And let me tell you how. Let's briefly talk about this, and then you will review the other information in my other blogs and other educational seminars. But as stress incontinence goes, this is what our results have shown: 97% success, less than 1% complication, and even those are all minor. No major complication such as hospitalization, blood transfusion, injury to the neighboring organs, nothing like that. It is done in the office, and women are back to work the next day with minimal pain. I do not give them narcotics. They have minimal pain, and they may take just Motrin to help with that. See? Tremendous changes when it comes to coughing, laughing, sneezing, leakage. Urgency incontinence, again, the details are in my educational seminar on overactive bladder. Tremendous strides we have taken in this. Several different medications are available. We have electrical stimulation called leg stimulation. We've got inner stem procedure. We have Botox therapy with proper combined therapy, over 90% improved and pad free. All in all, almost all cases managed in the office or office like setting. Very, very low risk of complications. If a procedure is done, patients are back to work the next day with minimal discomfort after the procedure, with a tremendously high success, low complication rate, with the advantage being that once it's done, it's done. You do not have to wear a pad at all as far as time can see, which is the main goal. So, gone are the days of bladder suspensions, gone are the days of catheter use. Soon gone are the days of pads, if you follow what I say. So, who would want to wear a pads if there is a solution for this problem? It's all about, therefore, knowing the correct information. If you start looking up and searching for sling and incontinence, and you go along on the wrong pathway and all this scary information, of course you'll be wearing pads. But once you get the evidence-based, real information, then you will know what your correct treatment plan would be. So let's have some fun and let's dissect this ad down. So first of all, you have this young lady. I'm wondering, why is she smiling? What is there to smile about? And that brought me to this little, slide I sometimes throw in. I laughed so hard, tears ran down my legs. We don't want that. No one wants to leak ever. Leaking urine is never normal. There is nothing funny about this. This condition should be respected and addressed like any other medical condition. Laughter should be fun, and we should not stifle it because it causes urine leakage. So please, nothing to smile about wearing a pad. Now you may say, well, look at that, great abs, she looks very young, she's too young and strong to have urine leakage. Not really true. A young woman in her 30s and 40s, or for that matter at any age, can have incontinence. So this is not an age-specific condition. In fact, the leakage with strenuous activities such as coughing, laughing, and sneezing can happen more often in the younger women because they are more physically active. So even a strong and a young woman can have urinary leakage. Remember I told you about this Costco aisle? Why that? Because look at this. 10,000 baby boomers turn over 65 years of age each day in the United States alone. So, over the age of 65, baby boomers, 10,000 per day. So, obviously, it's big business for these people to sell these products. Then I looked at, okay, let's see what the cost is. And this is what I found at Costco. $43, about 50 cents per Depend diaper. And again, she's smiling. Well, nothing to smile about. So let's do the math. So 50 cents per pad, the best case scenario, right? You're at Costco, at a wholesale dealer. An average number of pads used are about 6. So I look at the cost, it almost comes to over $5,500 by the time the patient comes to be assessed. That's a lot of money, You could put this money away, invest it wisely, and you would do great, and you could put your child through college just by saving on this money if you invest it wisely over time. More importantly, what are you doing? Pads do not solve the problem. They just hide it. So the moment you stop wearing a pad, the incontinence is right there. So you have no choice but to keep wearing them. And look what this ad basically showed. So if we look at the lower part of the ad, it says that, hey, this particular ad we're talking about, called this Always Discreet, it fits perfectly. This doesn't fit well. So this is already assuming that women should be wearing pads for incontinence. So it has the audacity to assume that. Prove them wrong. Don't wear pads. Say no to pads. Most cases of urine leakage can be successfully corrected. Wearing diapers is an absolute insult and detrimental to a woman's physical and mental well-being. Do not lose out on your prime years by suffering in silence and just dealing with it. No to pads. Would you therefore put a band-aid and hide this skin cancer, or would you get it taken care of? Well, then why would you put a band-aid on your incontinence and wear pads? Well, you may turn around and say, well, doctor, this is cancer, man. Incontinence is not cancer. Well, to that, I'll just have you read this next slide. This is what one of my patients very poignantly told me. Say no to pads and correct it. This is what it was before, right? We want this now. When you really laugh, tears should roll down your eyes. Well, don't be straddled by incontinence. Don't just put a band-aid on incontinence. Set yourself free so that you can jump, run. It does not matter whether your feet are getting wet or whether you hear the sound of running water or whether there is chill in the air. Nothing happens. You are free of incontinence. Thank you.